Anytime.
So I recently had a conversation with a friend of mine.
So, you immediately went to the right and went out for him.
All right, here we go.
Hold on, I'm going to, you back it out just a tad more. No. Try to be relaxed, but don't move.
So we're filming.
Yes.
So I recently had a conversation with a friend of mine, and she told me that she's afraid of disappointing her family, right? Because her family has high expectations of her. I'm sure we could all relate to this on some level, right? And so, she's like, oh, I can't choose this, I can't do that, I can't marry this person or so, right? And she's like, I just feel guilty. And the word was guilty, I feel guilty. And I'm like, I finally, told her, I'm like, the only thing that you're really guilty of is wanting to be your authentic self. If there's anything else to be like guilty of, even though like that's not the right word, right? It's like you're just trying to live your own life. That's it. And so there is no guilt to be carried here. It's just you wanting to be authentically you. Want me to do the metaphor?
No, we've done that a couple of times, and you've already posted that in the past. So
Yeah, you're right. That's the one I don't think it should be posted because I already did it. But I'll do it again if you want me to.
I'm going to get you a prop here.
Give me a cup.
Actually, I was thinking you should do the pain advice. You know how you do the presentation with it.
The broom is in there. That one will take longer,
Well,
but I can do it in segments.
Just remember, we're throwing shit at the wall and seeing what sticks.
Okay, don't give me the broom yet. I have one to start with, and then I'll do the broom.
Let's go.
Okay. So for people with chronic pain, I want to introduce you to something called the vicious cycles of pain theory for pain management. So it's basically a theory teaching us like things that we might be doing or not be doing that might be exacerbating our pain. The first one is guarding behavior. So when we're in pain, we tend to guard, right? If we have shoulder pain, we guard, we're protecting the shoulder. We may do this even subconsciously, like it's a instinctual survival mechanism, so to speak. However, when the muscles get really tight, trying to move them to normal position will cause a pain flare-up or a spasm. So one thing that could be beneficial is just breathing into your muscles and then just telling them to relax, just watching that guarding behavior, and time to time, even if it's on a minuscule level, you just slowly begin to relax your muscles. The second vicious cycle of pain is movement. Okay, so there's two kinds of people with movement, right? There's people that become couch potato. I was guilty of that too at my worst level pain, but you just don't move. And any physiatrist or pain doctor will say movement is your friend, and they're actually right. Okay, so what does this mean? It doesn't mean that you're going to go out and do a marathon. What it means is that at least every 30 minutes, if you can, just get up and you stretch. You do any kind of stretch or a little bit of the PT or a lot of it of the PT that you were given with, follow their advice. Or you walk around your house. If you're able to do it, you walk around the block. This is where the phones come in, where they're very useful. Like Alexa set an alarm for 30 minutes. Is it annoying? Yes, but you gotta move, and that will help you experience less pain in the long run. The third vicious cycle of pain has to do with sleep. So sleep is everything. If you get anything out of me, it is the importance of sleep when it comes to pain reduction. So when we don't get at least 7 hours of sleep, preferably 8, we are no longer in stage 4 sleep, which is a recovery repair sleep. Your mind and your body are repairing themselves during this period. And so there are certain tools or some advice that could help you sleep. So for people with neuropathy, getting a dehumidifier can really help. So inflammation leads to, I messed up. Okay. So the third vicious cycle of pain has to do with sleep. So this is one of the most important things to teach people about pain management is the critically important blah, 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 blah. The third vicious cycle of pain is lack of sleep. So people in pain tend to sleep less, or they become like a rotisserie chicken. They're turning from side to side because it hurts. But we need to get to something called stage 4 sleep, which is our recovery repair sleep. So the brain and the body are repairing themselves. So if we're not getting at least, very least 7 hours of sleep, straight sleep, then we are denying our bodies the ability to properly heal. So there's certain things that might be able to help. So a dehumidifier can be very helpful, especially for people with arthritis or neuropathy, because humidity leads to inflammation. Inflammation leads to pain. So that's one thing to try. A U-shaped body pillow for those who sleep on the side can be very helpful because it keeps your body in full alignment. Relaxation tools trazodone is a very popular medication for people with pain because it helps keep them in that stage 4 sleep. The fourth vicious cycle of pain is stress. Now, stress is a unique cycle because pain itself can cause stress. So thoughts like, what if my spouse leaves me? What if I can't work? What if workman's comp cuts me off? What if I end up in a wheelchair? These are very real concerns for certain people, okay? But the longer we stay there, the more stress we're gonna feel. And when we are stressed out, we have too much cortisol in our system, which is toxic to the system. It will, let me do that over. Now, the fourth vicious cycle of pain is unique in the pain cycle because this has to do with stress. Okay, so there is a direct connection between stress and pain. So this is why I advise some people, like, try not to watch too much of the news, and I don't care what political party you belong to, it's all kind of bad, and we gotta be as zen as possible. Because if your brain is producing too much cortisol, which is a stress hormone, it is toxic to the system. So what does this mean? It means that you reduce any kind of tension in your life as much as humanly possible. So if you have to distance yourself from certain people that stress you out, all you gotta say is look, I'm having a higher than normal pain day, I gotta bounce, I'll talk to you in a few days, just to alleviate yourself from that tension. Trying to watch more comedies instead of, let's say, violent content, unless that's your thing, right? But anything and everything to reduce your stress. Listen to passive muscle relaxation exercises on YouTube, calming music, or any kind of music that helps to elevate your mood. But what I tell people with pain is you no longer have the luxury of dealing with unnecessary bullshit.
Cool. I'd like you to do one for me, because this is working out splendidly. So what I'd like you to do is introduce yourself and what you do for these things. I mentioned that you're trauma psychologist and pain.
Yep.
All right, so when you're ready.
Hi, I'm Dr. Susie Flores. I am a trauma and chronic pain specialist. I have been a trauma therapist for over 25 years, and I was trained at the Rehabilitation Institute of Chicago in terms of treating chronic pain with pain psychology. It's called pain psychology because chronic pain is what we call biopsychosocial. It's biological, you have pain. It is social. Of course, it affects the way that you view yourself, other people, and how often you interact. And it is psychological because there is no way that your pain has not done a mind job on you. And in terms of trauma, I am trained in something called image transformation therapy, considered one of the most revolutionary techniques in our field right now that can really not just help you cope with trauma, but it takes it further. It helps eliminate traumatic memories in a very, very gentle and efficient and quick way. So please contact me at nola-wellness.net if you'd like to make an appointment or just even to have a consultation. We can talk about it.
Yeah, it was great.
Okay, we're done?
Yeah,
Let's
I mean,
go.
you got 8 minutes there.